Well, I'm thrilled to be here to give the Benson and Pamela Harer lecture at the ACOG conference. I'm just completing my 12th year at Planned Parenthood, and this is actually my last official act and nowhere I'd rather be. ACOG has been such an incredible partner to Planned Parenthood, and what I'll be talking about today is a bit of the history for women in this country and what has meant for them to have access to reproductive health care and rights, and the partnership that Planned Parenthood has had with ACOG, particularly during the 12 years I've been the president. The thing about ACOG that's been so important to us is they really stand for the patients that they serve, as well as preserving the important doctor-patient relationship. Unfortunately, for many, many years, I think there have been too many efforts by government to interfere in that relationship, and ACOG has always stood strong in the ability of patients to make their own medical decisions. I think it's important, though, to recognize, particularly at this moment, 101 years after Planned Parenthood was started, just the extraordinary advances that women have made, not only in terms of their health and better healthcare outcomes, but their ability to participate in the American economy. You know, I'll talk a bit today about the fact that we're now half the workforce in this country, we're half the undergraduate students. All kinds of opportunities have been opened up to women because of their access to excellent reproductive health care, including from many of the people that are going to be here today at ACOG. One of the reasons it was really important for me to be here is because of the partnership we've had with Dr. Hal Lawrence, the CEO and Executive Vice President for ACOG. He has been really a mentor to me, he's been a friend, he's been an enormous supporter of women's health care in America, and so it's really meaningful to me to be able to be here at this conference on my last formal day at Planned Parenthood. I think the main challenge we have is there are still millions of women in this country who don't get access to affordable health care, and of course I think, as we know, that is increasingly true depending on your immigration status, depending on where you live, your zip code. And so I think a big focus, a challenge that we're trying to address at Planned Parenthood is to make sure that every person has full access to family planning and reproductive health care, no matter where they live, no matter their income, because that's when we begin to see progress for all people. And it is a challenge, but every year I see that we make progress. And even in an environment that's sometimes really difficult for women's health care, I'm so proud of the work that we're doing in partnership with ACOG. I think the two most important things to me today are, one is that I want to thank ACOG for being such a partner to Planned Parenthood and the work that we do every day. And the second is how important it is to continue to lead on healthcare equity. And I know that's something that ACOG has been in the forefront of. We know that there's a rising maternal mortality rate, and it's particularly difficult for women of color. These are issues that I think we really need to focus on as a public health care community and make sure that of all the advances that we're making in healthcare, that women's health care isn't getting left behind. So I really appreciate the leadership of ACOG in this arena, and again, the partnership that we have with them, not only at the national level, but in states all across this country.